very sick are admitted to intensive care units. They are patients whose immune systems may be fragile, patients who may be just hanging on to life. A new study looked at a single day of more than 1,200 intensive care units, or ICUs, in 75 countries.
There is an additional perhaps 10 to 15% mortality risk associated with acquiring an infection in the ICU.
Dr. John Marshall of the University of Toronto and St. Michael's Hospital is one of the study's authors. He and other researchers found that more than half of some 14,000 patients in the study on that one day developed infections in intensive care units. The data shows that these patients were twice as likely to die as those who did not succumb to infections.
60% of the infections were pneumonias, about 20% were infections inside the abdomen, and about 15% were infections of the urinary tract.
In addition to being very sick, patients in intensive care may be on ventilators, they may be hooked up to intravenous lines, or may be using catheters, which increase the risk of infection.
One of the things that this study actually allows us to do is to begin to get a sense as to how much of the burden of infection is an added burden on a patient who is already at risk of dying because of the underlying diseases that led them to be in the intensive care unit.
Two other important findings come from this study. Patients who stayed in an ICU 7 days or more were more likely to become infected, and patients in developing countries were more at risk than those in ICUs in wealthier countries. The researchers say they hope the study leads to better infection prevention and management. Carol Pearson, VOA News.